Hi, I'm Asif Taqi. I'm an interventional and a stroke neurologist and a medical director for neuroscience at Los Robles Hospital. We're talking about the Ventura ELVO Score today, and we'll go over the components. Just a little background, the score is developed to identify large vessel occlusion in patients who are having a stroke, so they take into an appropriate center in a timely fashion. The score consists of 4 components: forced eye deviation, neglect, aphasia, and obtundation. And we'll go over all the 4 components and how to examine the patient. Number 1 is forced eye deviation. That suggests that the involvement of a frontal lobe in a patient. When you walk up to the patient, both eyes will be deviated to one side or the other, and they may not be able to correct it and bring it all the way to the other side. So let's see how we examine it on a patient. Okay, so forced eye deviation. When you look at the patient eyes would be deviated to one side, and as you can see, both the eyes will be deviated. You can ask the patient, can you follow my finger? So they will follow up to the midline, and then it would not go to the other side. So it could be right or left depending on what side of the stroke they're having. The second one is a little tricky to identify and a little bit challenging to examine in a patient, which is aphasia. Aphasia is a disorder of language, not the speech. So if somebody is having dysarthria, which means they're slurring their words, it's different than aphasia. Aphasia means that they cannot either process or have a problem with the output of the speech center. So there are few things that we can do to identify if a patient is having aphasia or not. One is we can ask them to repeat a sentence after us. So normally I ask them if you can say I'm in the hospital or I'm in the ambulance, and ask them to repeat that sentence. The second thing is to name an object, which would mean you can show them a pen or a key, whatever you have available in your pocket, and ask them to name that object, and they would not be able to name the object. The third thing is sometimes they talk, but they talk irrelevant and gibberish language, which means that they may have words, but the words won't make any sense. The fourth part of the aphasia is mute. If somebody is globally aphasic, whatever you're telling them or asking them, they would not be answering any questions, they would not be understanding everything. So let's see how we examine that on a patient. Right. So to evaluate the aphasia, the first thing we do is to ask the patient to repeat a sentence. Can you say, I'm in the hospital? So either they will not say anything, or they may say something gibberish. The second thing is to ask them any object, whatever you can find in your pocket. Usually ask, can you tell what is this?
A bag.
So they may ask, they may say something that is not true or say something that is not comprehensible. Can you say, what is this? Okay. So the third thing would be that they would have incomprehensible language. They may be saying things which are not appropriate or does not make any sense. Can you tell me your name?
Yes.
Do you know where you are?
Fork.
So sometimes they would just talk in a normal words, but the words won't make any sense. And the fourth component is they are completely mute, which would mean that if I ask them any questions or ask them to do anything, they would not say or utter any words. So that's the global aphasia, where the patient is completely mute. The third component is neglect. And again, it gets a little bit tricky and challenging to examine a patient who has neglect. Sometimes they have gross neglect, which is the neglect that we are looking for, and sometimes they have fine neglect. Fine neglect is hard to evaluate in the field, but let's talk about the gross neglect, which would mean that the patient is ignoring one side of the body. One way to identify it, if you're standing on the right side of the patient, they are ignoring you, but if you're standing on the left side of the patient, they would interact with you and talk to you. So that means they're ignoring one side. To examine the patient, let's see how we examine it on a patient. So how do we check neglect on a patient? Again, it's a little bit tricky. If patient already has eye deviation to the right, it may appear that they have neglect on the left side. So the best way to do it is to do a simultaneous stimulation, which means we ask them, they can raise their hand or they can have their hands lower. That's not important, but you ask them, what side I'm touching, right or left?
Right.
Now?
Left.
Close your eyes. Tell me what side I'm touching now.
Right.
Is it right, left, or both?
Right.
Okay. So the patient would ignore one side or the other when you give them a simultaneous stimulation. So when you ask them individually, they will identify, but when you ask them with a simultaneous stimulation, they would not be able to tell one side or the other. The fourth component is obtundation, which means that they are not fully aroused. It's one step closer to being comatose. So if a patient exhibits signs of a stroke and they're obtunded, it usually suggests that they have a basilar artery occlusion. Let's see how we examine that on a patient. Okay, now the last component is actually observation, not so much examination. When you're talking to the patient and if they're not fully awake, they're going to sleep in between the conversation. So let's say this patient, I wake her up. What's your name? Can you tell me your name? So they will open their eyes, but they will go back to sleep either after responding or without responding. So that's a one step before patient is comatose. So when they're completely comatose, obviously you don't have a formal exam, but a step closer to comatose is obtundation, which means that they would wake up but with the stimulation, but then go right back to sleep. Okay, that concludes our video for VES score.